Hi there, this is Mickey Sperlich again. Hopefully you've already watched the Asking About Trauma video. In this video, I'd like to discuss some basic considerations for responding to trauma disclosures in the context of doing assessments, as well as responding to spontaneous disclosures. So, you've asked a woman about whether or not she's experienced trauma or adversity. She says yes, she has. Now what? First, it's important to listen well. Give the client your full attention. Don't interrupt or look down or take notes or fidget. Paying full attention shows that you care. As former US President Teddy Roosevelt once said, "Nobody cares how much you know until they know how much you care." You might have all the knowledge in the world about treating trauma, but if the client in front of you doesn't think that you care about them, they're not going to share any of their personal information in a meaningful way. This, of course, can be challenging on a busy workday when you are overextended. You may need to take a brief break between clients so that you can focus and reset your intention for listening well while administering the ACE questionnaire as part of the SMC. Note that the ACE is designed as a yes-no response set, meaning that typically a survivor does not have to share any details at all about their trauma if they do not wish to do so. And we strongly encourage you as a tutor not to invite any details to any of the yes answers. But some survivors might spontaneously fill in the details. In this instance, again, you must listen well and be prepared to respond. So after listening well, the second thing to do is to thank the client for sharing their personal information. For some folks, this is a very difficult thing to do, even if all they've done is said yes to a specific ACE question. This may be the first time that a provider has ever asked them about their trauma history, or the first time they've disclosed it. Thanking the client for sharing is one simple way of acknowledging that you heard them. Not saying anything at all could be perceived as shaming or blaming and can have the effect of silencing the survivor mom. Third, you need to validate, empathize, and show support. Try to do this in a way that does not layer your judgment on top of the situation or express pity for the client. You could say things like, "I'm so sorry that happened to you," or "This is not your fault," or "You did not deserve this," or "I imagine that has been difficult for you." Avoid suggesting that they try not to think about it, or just get over it, or try to move on. Fourth, we need to make sure to right-size our response. Try to match the survivor mom's feelings about the disclosure. A client may have had significant trauma exposure, but if she's been to therapy and a significant amount of healing has taken place, her trauma-related needs might be fairly minimal. She may have a relatively easy time sharing her history with you. In this case, your introductory explanation about why you are asking about the trauma, together with your active listening skills, may be all that's needed. It may be enough for the client to know that although they are doing fine right now, help is available if and when needed in the future. Other clients might find it much harder to share their sensitive information. If a client's body language is closed off, they have crossed limbs or looking away, and if they answer reluctantly or quietly, your response could be something as simple as a sympathetic, kindly nod, or saying, "I'm so sorry about your experience. Thank you for sharing that." If the client is more expressive, perhaps tears up a bit or seems embarrassed, then you may have to add something along the lines of, "You're certainly not alone in having experienced that. It's so uncommon, unfortunately." If this is the first time that the client has disclosed, and particularly if current abuse is going on, the client may cry or start spilling out the details of a traumatic exposure. Right-sizing your response in this situation will include not only thanking them for sharing, expressing empathy, and normalizing that they're not alone, but also letting them know that help is available for processing and working through their trauma, and that you have resources that you can connect them to. It's critically important to have current vetted referral resources in hand before you start to ask about trauma histories. This will enable you to explain to a client who is upset that they truly deserve to have a dedicated place to process their trauma, and that although you are honored that they shared their story with you and you have the SMC tool to help them learn more about their trauma reactions and build skills for dealing with them, that the SMC is actually not the appropriate venue for processing trauma specifically. For processing trauma narratives, a survivor would be better served by engaging a trauma-specific therapy, which you are standing ready with referral resources to help them find. The wording for discussing this with a survivor might look like, "Thank you for sharing about all of that, and I'm so sorry that happened to you. As we go through the program, you may see situations that ring true to your experience, and if you wish, we can discuss each thing as it comes up. That may be less distressing for you to take it in pieces rather than trying to process your trauma as a whole right now, and it might help you to manage your level of distress as we work together. If you would really like to look into a deeper level of processing this experience, however, I have some great resources I can refer you to." This is particularly important for survivor moms who disclose that they are currently experiencing violence or other abuse. The ACEs questions ask only about childhood experiences, but they may trigger spontaneous disclosures of current abuse as well. If this is your client's situation, keep the following points in mind. First, it is not appropriate to tell a person in an abusive relationship that they should leave their abuser. There may be reasons why this is difficult or impossible. She may be financially dependent on the abuser. She and the abuser may have kids together who may be at risk. She may perceive that leaving the situation will make things worse, and she may be right. In fact, research shows that a person is actually in the most danger when she leaves an abusive relationship. Also, suggesting that she just leave can make her feel like she is weak or to blame for the situation. Although you may have a mandatory duty to report current violence directed toward a child or a dependent adult, an independent adult has the choice to report or seek help for their situation. Related to offering referrals, it's important to remember that it is disrespectful for us to assume that we know what is best for another person, or to assume that we know how they feel about their trauma or abuse. So after a woman has disclosed her trauma to you, it's important to ask if this is something that she would like help with, and whether there are any known triggers the client has that might affect their interactions with you. For instance, in my role as a midwife, I really want to know whether specific situations or procedures might trigger past trauma for my clients, and whether they had specific suggestions for how we could avoid or minimize those. Even if a person discusses known triggers or challenges, we can't automatically assume a person needs therapy just because they've disclosed a traumatic or emotional story with you, or shared that they have some specific needs around that. They may not be ready to go into deep trauma processing, or they may be just glad to have told someone and gotten a little bit emotional in the process. Or they may just have more pressing priorities in their life right now. So keep in mind when you are offering a referral to ask whether this is something they are interested in the first place. I have one last big recommendation toward right-sizing your response. The ACE questionnaire is a screening tool, not a diagnostic assessment. The SMC is an educational intervention rather than a mental health treatment or therapy. Because of these differences, it's not appropriate to probe for more details of the trauma. If a person spontaneously starts sharing details with us and we can't head them off this path, we should do the following steps. First, listen, then thank them for sharing when they are finished, empathize and validate their disclosure, and then let them know that they deserve to have more dedicated time spent processing their trauma, if they so desire, and that you can connect them to the appropriate resources for getting them the help they need. There are a variety of successful evidence-based approaches to treating the effects of trauma, including individual psychotherapy, group therapies, and more. You might want to practice a simple grounding or breathing exercise to have ready to share with clients to help them recover after a lengthy or emotional disclosure. You can ask your survivor mom if she would like to finish the ACE questions or continue at another time. By doing this, we're trying to provide a safe space for the client to share while maintaining our professional boundaries. Ultimately, we want to honor the client's lived experience, but point them in the direction of the most appropriate and comprehensive care possible. Another thing to consider is that although some survivors may share with you and some may disclose details, others may not choose to disclose. They may not have total recall of the traumatic events, or they might not yet be ready to acknowledge or address their history of trauma. We cannot assume that because a person does not disclose trauma that they have not experienced it, or that they have no issues related to trauma. Often, we may suspect a person has a significant trauma history in the absence of a disclosure. Fortunately, keeping to the basic principles of a trauma-informed approach will go a long way toward addressing the needs of our survivor moms, regardless of whether or not they disclose. Core trauma-informed principles like working to establish physical and emotional safety with clients, being trustworthy and transparent in our interactions, collaborating with clients in their care, empowering them to make choices for themselves. These are all helpful ways of thinking and interacting with everyone. You can find out more about the trauma-informed approach by downloading a guidance document from the United States Substance Abuse and Mental Health Services Administration website, or visiting the website for the University at Buffalo's Institute on Trauma and Trauma-Informed Care. Finally, and importantly, I'd like to talk about what it's like from the tutor perspective to hear someone talk about their trauma. It's definitely true that those of us working in the helping professions are at risk for vicarious trauma, compassion fatigue, and burnout. It's important to do what we can to take care of ourselves and manage our reactions to others' stories of their traumatic experiences. In their book called Transforming the Pain, a workbook on vicarious traumatization for helping professionals who work with traumatized clients, authors Sackvitney and Perlman suggest we consider the ABCs of managing secondary trauma: awareness, balance, and connection. Awareness means becoming more aware of your own trauma history and learning what helps you take care of yourself in the best way. Balance refers to giving yourself permission and time to fully experience your own emotional reactions and set boundaries as possible around work and personal time, and take notice of any negative coping behaviors and work towards substituting more positive ones. Connection refers to seeking input from colleagues and supervisors, debriefing after difficult interactions with clients, and seeking support and connection to friends and family members. It's also about connecting to mentoring or new learning in areas that are of interest to you. In the words of author Rachel Naomi Remen, the expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. This sort of denial is no small matter. The way we deal with loss shapes our capacity to be present to life more than anything else. The way we protect ourselves from loss may be the way in which we distance ourselves from life and help. We burn out not because we don't care, but because we don't grieve. We burn out because we've allowed our hearts to become so filled with loss that we have no room left to care. Asking about trauma is important for a variety of reasons. Assuming it is done in a sensitive, empathetic way, asking about such experiences can have a normalizing effect for survivors who feel stigmatized by what they've gone through. In my experience, speaking about traumatic experiences can also have the effect of a cleansing release for some trauma survivors and a chance for them to move forward in their overall healing. I hope this information has been useful to you, and I thank you for listening and watching.